Hi, my name is Ashley Gallegos, and today I will be showing you how to measure a person's vital signs. So there are 5 vital signs. There is respiration, blood pressure, temperature, pulse, and pain. So the first thing you want to do before starting a procedure is to knock before entering. Then you are going to address the patient or resident by their name. Then you are going to address yourself by your name and your job title. So I would say, hi, my name is Ashley Gallegos. I am a CNA student. Then you are going to, before and during the procedure, you are to explain the tasks that you are going to be performing to them. Then you are to also protect the person's rights and also be gentle with them throughout this procedure. So before any procedure, so I am going to be doing the oral temperature first. So I am going to practice hand hygiene, wash my hands. Then I'm going to gather all of my materials. So I have my temperature, the thermometer. Then after I have gathered all my materials, I am going to wash my hands again. Then I'm going to identify the person with 2 identifiers, and then I am also going to provide for privacy, so close any curtains, close the doors, anything like that. So the first thing that you want to do is put on your gloves. So I am going to be putting on my gloves. Then I am going to take the thermometer. Then I'm going to tell my patient not to eat, drink, smoke, anything like that 15 to 20 minutes prior to me giving their temperature. Then I'm going to take the thermometer, which I already did, and just wash it with cold water and clean it. You don't want to do warm water because warm water makes it sticky and gets all stuck to it. So then I'm just going to dry it with my wipe. And you could place it back in here until you go by the patient. So now I'm going to be telling my patient to moisten his lips, so just lick them. And then to put up your tongue, and then I'm going to put the thermometer on the side, and then he could close his tongue and his mouth, and then the thermometer is held by his mouth. So typically for a glass thermometer, you are to leave it in there for about 2 to 3 minutes, and also before you put the thermometer in their mouth, make sure that you just check for cracks or just cracks or anything like that in the thermometer, and also make sure you shake it so all the mercury goes down. So we're not going to wait for 2 to 3 minutes, but if it was, so the way that you read it, so it goes 96, and then the big line is 97, and then the other one's 98, and then the little ones are 0.2, 0.4, all that. So I could just rinse this and clean this off. And then after the procedure, I am going to be taking off my gloves and then discarding these. And then also, when you're done with the procedure, provide your patient or resident with comfort, unscreen them, do a safety check, put the call light back within their reach and any other items, and also just report their temperature. So we could pretend that my patient's temperature was 98.4, which that is normal because the normal range is 97.6 to 99.6. And if they had an abnormal temperature, just report that to the nurse immediately. So after that, and then also make sure you wash your hands when you are done. So after that, now I will be showing you guys how to find a radial pulse. So the pre-procedure is all the same, and the quality of life is all the same. So I am going to be making my person sit or lie down, so my person is sitting. And then the way you find the radial pulse is it is where towards the thumb side. So you could just use your two index fingers or 3 of them. Just don't ever use your thumb, because then you can mistake your pulse with their pulse, and that's not good. So once you find their pulse, I am going to be counting it for 30 seconds and then timesing it by 2. So I am going to count now. Okay. So it was 31, and so I would times that by 2. So 31 times 2 is 62. And so that is normal, because the normal range is 60 through 100. And also when you are reporting anything, you are also looking for just abnormal or normal heartbeats, if they're irregular, regular, anything like that. And the post-procedure is the same as giving temperature. So after that, now I am going to be showing you how to count a person's respiration. So respiration and radial pulse is never done at the same time. And also when you are counting a person's respiration, you do not want to let your patient know, because usually then they will change their breathing patterns. So we are just going to pretend that we are still taking their radial pulse. So I'm going to have his arm out and then have my 2 fingers on the radial pulse, and then I am going to be looking at his chest. And the way that you count respirations is when the chest rises and then goes down, that is 1 respiration. So we are going to be counting it for 30 seconds. Okay, so after that, the post-procedure is the same. Provide comfort, put the collet back where it is supposed to be needed, unscreen the person, anything like that, hand hygiene, all of that, and also record what you counted for the respirations. So I counted 9, and then I'm going to times it by 2. And I got 18, which that is normal, because the normal range is 12 through 20. So, and also when you are counting a person's respiration, you just want to look to see if they have any abnormal breathing patterns, or if one chest is rising and the other isn't really rising, just anything like that. And if you have seen any abnormal stuff, you would just report that to the nurse immediately. And also for radial pulse and respirations, I did it for 30 seconds and then I times my number by 2. But if the nurse or the care plan says to do it for a minute, then you are supposed to do it for a minute instead of timesing it by 2. So it just depends. Now I am going to be showing you how to measure a person's blood pressure. So the items that you are going to be needed is a blood pressure cuff, a stethoscope, and then antiseptic wipes. So the first thing that I am going to be doing is cleaning the diaphragm and the earpieces. And so I am going to have my person, his arm is going to be level to his heart, and then his palm is going to be facing upwards. And so now I am going to be finding the brachial artery. So once you find the brachial artery, you are going to find the arrow on the cuff, and you are going to line that up with the brachial artery. Okay. And when you put this on, you want it about 1 inch above the brachial artery. And you don't want the you also hold on. This is only backwards. Okay. You also don't want it to be on too tight, and you don't want it to be too loose, so it should fit like a snug. And also, before you put this on, just make sure you expelled any of the air out, and make sure that you close the valve. And so now I'm going to be putting my earpieces in, and also I'm going to be putting the diaphragm on the brachial artery, and then I am going to squeeze this until I cannot feel the pulse anymore. And then after that, I'm going to record that number on my notepad, and then I'm going to squeeze this again until 30 mmHg, and then after that I am going to record my data again. So now I am going to record my data, and then I'm going to take this off of my patient, and I'm going to put all my materials back and then wash my hands. And so my patient's blood pressure was 120/75, which that is normal because the normal range is 120/80. And that is how you measure a person's blood pressure. And then the 5th vital sign is pain. And so you are just looking to see if your patient or resident has any pain anywhere, or if it's objective or subjective, anything like that. And that is how you measure a person's vital signs. Thank you.